The current COVID or coronavirus pandemic has certainly impacted all of our lives. We obviously are in a completely uncharted world where social distancing and changing the way we live at home instead of going to the doctors and having our normal lives. So it's been a major impact. Here in the New York area, which has been extremely hard hit in the United States, but it's not limited just to the big cities. We have changed the way we treat our patients here in the office, screening patients before they come in. Obviously, the hospital has completely changed, but it's affecting all parts of our lives. And especially it's affecting the older individuals and the people with coexisting diseases like myelodysplasia fairly severely, but hopefully we'll get through this time period. The coronavirus, affects patients by causing them to have shortness of breath, fever, coughs, and unfortunately, in some individuals, respiratory failure that causes them to go to the hospital. Because of this, we've had impact on our ability to use the hospital for other reasons, such as elective surgeries and some of the care that we deliver to some of our cancer patients and patients with myelodysplasia and other serious blood diseases. The impact on the hospital and on our clinic has been a lot in the blood supply. We need blood for a lot of the patients who are in the hospital with the coronavirus infection, and that has drawn the blood supply down to very dangerously levels. In addition, the number of people who've donated blood has gone down dramatically because of fears by the donors about being safe as they're doing the process. The American Red Cross, as well as the blood banks across the country, have taken this to heart, have increased the appeals to bring people in to donate, and have made changes in the way they schedule appointments and bring in donors to get blood. We've also loosened the restrictions to allow other individuals who might not have been able to donate blood before to become donors. But this is a big problem for our patients with myelodysplasia because blood is literally their lifeblood. It is what keeps many of them alive, keeps them with quality. So if you have the opportunity to help a loved one by becoming a donor, that would be a great thing to do, especially in this time of charity when we're thinking about appeals like the Giving Tuesday Now program. The care of patients with myelodysplasia has typically included only a few medications. So therefore, research is extremely important if we're going to be able to offer new therapies to our patients. So there are many clinical trials for patients with myelodysplasia and with acute leukemia, as well as the other blood disorders and bone marrow failure disorders. Many of these trials, unfortunately, have been interrupted because of the current coronavirus pandemic. For patients who are on clinical trial, we've tried to keep them on study as the sponsors have allowed us. We've altered some of the visits to try to make as many as telemedicine and to try to reduce the number of exposures for the people who are enrolled in the trials. But unfortunately, we've seen some trials slow down. We've not been able to enroll as many new patients on because we're not seeing the new patients as much in our offices. But still, we want to encourage research when it's possible. But certainly, this will slow down some of our advances. Hopefully, what we're going to learn from the coronavirus is there's a lot of research being done in that area, and maybe some of that will translate to help our patients with MDS. Well, typically with patients with MDS, we divide them into two big categories. There's a group of patients with MDS that we call that have low-grade disease or low-risk disease under the International Prognostic Scoring System. And then there's a group that we call high-grade or high-risk under the IPSS scoring system. In the low-grade, typically it's anemia, which is low red count, which makes people a little more fatigued, a little short of breath, and no evidence of leukemia cells or high risk features. For these patients with low-grade disease, we typically have used supportive care, transfusions, maybe weekly injections of red cell stimulators such as erythropoietin. The American Society of Hematology, the group that many blood doctors belong to, has recently made some recommendations to help doctors through this coronavirus pandemic. And they've recommended for patients with low-grade disease, where treatment has generally been supportive, that we might want to try to if possible, spread out our visits, use less blood transfusions if possible, and take a more quiet approach, allowing the patients with the individuals with low-grade MDS dysplasia to maintain social distancing for their own personal health, and also to allow us to keep the vital resources for those patients infected with the endemic. On the other hand, there are patients who have high-grade disease. These are patients who have very low blood counts, who are at risk for infection. These are patients who might be already moving towards leukemia. In these patients with high-grade disease under the International Prognostic and Score System, treatments with the hypomethylating agents, 5-azacitidine and decitabine, have become the standard of care worldwide. 1 week of treatment with these agents per month has been shown to improve survival. In addition, the 1 week per month with these agents improves quality of life and slows the progression to acute leukemia. Therefore, the American Society of Hematology is recommending that patients with high-grade myelodysplasia continue to receive their therapy on time, on schedule, at the appropriate doses, not skipping weeks, not suppressing, spreading out the visits, not decreasing the dosing. That's because we know that these therapies improve the lives of our patients with high-grade myelodysplasia. And if we discontinue or stop, the patients could lose their response, and there's no guarantee we'd be able to recapture them. So for our patients with MDS, you should be talking to your doctors, finding out what type of MDS, what type of therapy you've been getting, and see if it's safe to continue the therapy or whether you are able to spread out your visits. But I want to emphasize that for many patients with high-grade myelodysplasia, it's important to continue treatment even during this difficult time. I know during these difficult times with the coronavirus pandemic, we're all focused on this terrible infection. But we do need to remember that patients with myelodysplasia do need our support, and that there is much work still to be done to keep the advances in science moving forward, and also to support patients with the routine care that they need in today's world for treatment of these blood disorders. This week, we're holding Giving Tuesday Now. It's an international effort to think about the charities that you support, to make sure that you help your neighbors. Social distancing doesn't mean that you don't help your neighbors. It means that a time for you to reflect on what's important to you and to be able to help their neighbors even more. The MDS Foundation relies on donations, and this is a time to think about the MDS Foundation, how you can help, either through volunteering or through your financial support. Each year, the MDS Foundation holds MDS awareness walks in various cities where we raise money to support and to raise awareness. This year, the walks in the summer obviously have been postponed to the fall, but we know that people can still donate to those walks. And through May 5th, if you donate to one of those walks, we have received a generous contribution from one of our donors that will match your gift. So therefore, during this Giving Tuesday Now campaign, which is for all of the charities, remember to think about your patients and your friends and your loved ones who have myelodysplasia and how you can help support the MDS Foundation.